Great, thanks everybody. We're excited to tell you about OPCOMM. This is a company that was born out of frustration. So today in the operating room, we're doing amazing things like doing a face transplant. And yet coordinating that surgery is done by archaic technologies. But these bad technologies have a $3 billion opportunity for our company. So this is OPCOMM. It's a software company. It's the ultimate micro-collaboration tool for use in the perioperative setting. And first, let me just pause and tell you about our team. I want you to take away this point that our team will get us to market. I'm David Grant. I founded a company, educational company called Stem Cell Talks in 2009 in Toronto, and it's now in every major city in Canada. This is Raf. He co-founded a company called Eurostat 2 years ago and actually stood on this stage to present. He is a patent-protected company co-founded by an engineer. Our CTO, Jamie, he's a full-stack coder. He co-founded a HIPAA-compliant messaging company a few years ago as well. We have 3 business people that are both MBAs in accounting. And then our John, our chief advisor, he's an MBA JD from Northwestern. He's a VC, previous entrepreneur, and he's based here in St. Louis. So let us just tell you about the day of surgery.
So for those of you who haven't had surgery, I'm going to walk you through a day of it. So you go to the hospital with your family. And the first thing you do is you're going to go to registration. You're going to go into the hospital, you're going to go to the registration desk, you're going to sign up. And after you register, they're going to bring you to a place called the pre-op holding area. And at the pre-op holding area, you're going to meet many different providers. You're going to meet the surgeon, the anesthesiologist, the CRNA, the resident, multiple nurses, a circulator. No other division in the hospital has this many healthcare providers for one patient. So here, Dr. Sun is marking the patient, consenting the patient, and after he's completed all his tasks, he's going to go sit in the corner and wait while Mark, the nurse, is going to check the home medications, put in an IV, etc. And when Mark is done, he's going to step aside and do something else, and the nurse practitioner or the CRNA and the anesthesiologist will come and introduce themselves as well. So after all these healthcare providers come, then the circulator comes and checks off these things, making sure that the patient has completed all these tasks so that we can roll back to the operating room. So just to review, we have many different care providers for every single one of these patients, and we have to collaborate on a day-to-day basis. So here at Barnes, let's just say one operating room, you schedule 5 to 7 procedures. And you can see OPCOMM tries to organize the disorganized time between cases. Many times, these healthcare providers change throughout the day. Now, we have about 40 operating rooms, and you can see we have about 200 micro-collaborations per day. And if you extrapolate that, in a week, you have about 1,400 micro-collaborations.
So let's just take a guess in the audience. This is Barnes Jewish Hospital, top-tier institution. What do you think the technology is that's used to coordinate these micro-collaborations? It's laminated cards. So enter OPCOMM. It's a software company that's built for the operating room pre-op area for micro-collaborations in that setting. And we're not inventing anything new. We're just taking data that was originally going from a computer to a printer or a screen that's stationary, and we're redirecting it into a smartphone. These are both portable, you can take them anywhere in the hospital, and they enable new features. These are 3 of 4 BPM companies that we've been in touch with, and they've told us, yes, they can build out this technology for us. So this is one patient, it's a case, surgeon. This is that team that is involved in this patient's care. This is the live checklist. And if something is not done, you have the ability to either send a group message or call that person. And because these are all of the check marks involved in turnover time between operations, we can now measure why turnover times are longer or shorter than they are. If you can't measure it, you can't change it.
So us surgeons, we created, of course we're going to like it, but we reached out, we surveyed, we asked the other folks, the CRNA, the anesthesiologist, the charge nurse, would they be willing to use it? And yes, they would welcome it with open arms. But more importantly, instead of focusing on the process of getting a patient to the operating room, we want to focus on the patient themselves. So if we look at our hospital, Barnes Jewish, if we decrease the OR time, we can add more cases and be able to add more cases by increased efficiency. And that's estimated to have a $6 million impact just at Barnes alone. There's about 5,000 surgical centers across the country, and if we were to add 1 case per day, that would generate $2.6 billion. So, if you take a look at all the academic institutions across the country, large tertiary centers such as Barnes-Jewish, and you add that with the 5,000 surgical centers, this will equal $3 billion per year. So what else can we do? We can decrease overtime pay. We can improve staff satisfaction by decreasing the turnover where we have to hire and rehire and train, decrease burnout. We can make better use of their time. So as a surgeon, I could be doing other things. I can be seeing consults. I can be discharging patients. We can form better team collaboration, and we can decrease OR time, and ultimately increase patient satisfaction and increase patient safety.
So who at a hospital is going to say, yes, I want this technology? It's going to be the perioperative services administrators. Our revenue streams will be based on an installation fee and then a monthly per user subscription. We're going to start with large academic centers, then move to larger community centers, and finally end up in the mid-sized community hospitals. There are 4 basic things that are needed in our space. One is HIPAA-secured messaging, data display, integration into existing scheduling software, and then agile micro-collaboration tools. OPCOMM is the only one of our, so we have many competitors, but OPCOMM is the only one that does all 4. So this company was founded in the fall of 2017. We've hit many milestones. Our next one is going to be developing an MVP with the BPM platforms that we talked about earlier, and then ultimately launching a pilot with a hospital here in St. Louis. And so today, we do amazing things inside of the operating room. Robots, laparoscopy, face transplants. We want to take that technology and move it outside of the OR. Thank you.